Hello, my name is Fatimah Jan. I am Assistant Professor in CTU University, School of Pharmaceutical Sciences, Ludhiana, Punjab. Today I am presenting the topic that is the antibiotics. So in this antibiotics we will cover up, first of all we will go for the antibiotics, what are antibiotics, and history of penicillin, classification of antibiotics, nomenclature of penicillin, SAR of penicillin, and beta-lactam antibiotics, and also we will discuss about the side effects of antibiotics. So here we have a term that is the antibiotics. First is, what are antibiotics? The word antibiotics are made up of the two words. One is the anti and one is the biotics. If we are talking about the anti, that means that is the oppose, or we can say that is against. So if we are talking about the biotics, what the biotics mean? So biotics, we can say that is the small microorganism. So here we can define the antibiotics. These are the chemical substances produced by the microorganism. Here I am using the word that is the microorganism. Which type of microorganism is that? It may be the fungi, it may be the actinomycete, it may be the bacteria. So which has the capacity of the inhibiting the growth or even destroying the another microorganism. This definition gives the Volksman. So in other words, if we have to define the antibiotics, at that time we can say antibiotics are the chemical substances or drugs produced by the microorganism or marine sources which will be inhibit the growth of another microorganism in small concentration and kill the microorganism in high concentration. So if we are making the antibiotics, so we are making that antibiotics from the microbes. Microbes are the natural sources. We are synthesizing that antibiotics from the plants. So from the microbes we are making the antibiotics. So antibiotics are not effective against the antiviral drugs. So if someone is having the antiviral infection, at that time he or she cannot be take the antibiotics. At that time we are providing the medicines. So that medicines we can say that are the antiviral medication. So antibiotics also includes the synthetic and the semi-synthetic antimicrobial compounds. Here we have some example, that is the chlorophenicol and sulfonamide. Next we have a history of penicillin. So penicillin was discovered by Alexander Fleming in 1928, who noticed that one of his experimental culture of Staphylococcus was contaminated with mold or fungi. In previous slide I told you we are collecting the antibiotics from the microbes. So penicillin was the first antibiotic. So that penicillin we are synthesizing from the fungi. So fungi is a bacteria. So we are collecting the penicillin from the bacteria. That bacteria is a fungi. So this mold caused the bacteria to leave, since mold belonging to the family that is the penicillium. So Alexander Fleming gave the name of the compound that was the penicillin. So penicillin is obtained from the Penicillium notatum, and also Alexander Fleming got Nobel Prize for explaining the penicillin. Not only the Alexander Fleming got Nobel Prizes, all the scientists who discovered the antibiotics, they got the Nobel Prize for discovering the antibiotics. So here we are talking about the penicillin. So Alexander Fleming got Nobel Prizes for the explaining the penicillin is a chemical extracted obtained from the Penicillium notatum, which stops the growth of other microbes. And Volksman in 1942 gives the definition for the antibiotics. Here we have a next topic, that is the classification of antibiotics. What are the classification of antibiotics? How many types of the classification of antibiotics? So antibiotics can be classified into the 4 classes. One is the based on the spectrum, and second one that is the based on the source and origin, and the third one that is the based on the mechanism of action, and the fourth one that is the chemical structure. So here we will discuss one by one. So first one, that is the based on the spectrum of activity and degree of selectivity. So they have the two subclasses. One is the narrow spectrum antibiotic and the second one, that is the broad spectrum antibiotics. First we have to know there are the two types of the bacteria. One is the gram positive and one is the gram negative. So whenever we are taking the narrow spectrum antibiotics, at that time they will kill only the one type of bacteria, whether it's a gram positive, whether it's a gram negative. So here we can define the narrow spectrum antibiotic. It is high degree of selectivity towards the single species of the microorganism. So here we have some examples. They are belonging to the narrow spectrum antibiotics. Example, we have a nystatin and we have a bactericin. So these types of narrow spectrum antibiotics can kill only the one type of bacteria, whether it's a gram positive, whether it's a gram negative. So second, we have a broad spectrum antibiotics. So what are the broad spectrum antibiotics? So I told you there are the two types of the bacteria, whether it's a gram positive, whether it's a gram negative. Whenever we are taking the broad spectrum antibiotics, that broad spectrum antibiotics can kill the both types of microorganism, whether it's a gram positive, whether it's a gram negative. So here we can define the broad spectrum antibiotics. We can say they inhibit the growth of gram positive and gram negative, includes the different species of microorganisms. We have some examples of the broad spectrum antibiotics. For example, we have a tetracycline and we have a chlorophenicols. So they can kill the gram positive and the gram negative. For example, if someone is having a fever, at that time we are given the drug that is the broad spectrum antibiotics. At that time he or she will be infected from the urinary tract infection. So if he or she is taking the tetracyclines, he or she is taking the chlorophenicols, they can treat the fever as well as these medicines can be treat the urinary tract infection also. So that's why we can say that are the broad spectrum antibiotics. They can kill the both gram positive and the gram negative, as well as if the man is having a problem of urinary tract infection, so at that time he will be free from that disease when he or she is taking the tetracyclines or the chlorophenicol. So next one, we have a based and source based on the source from which antibiotics are obtained. They are classified as we are obtaining the antibiotics from the three types. One is the natural antibiotics, and second one, that is the semi-synthetic antibiotics, and the third one, that is the synthetic antibiotics. So what are the natural antibiotics? In first slide I told you we are synthesizing the antibiotics from the microbes. So microbes are the natural sources. We are collecting the antibiotics from the plants. So plants are the natural source, and also we are collecting the antibiotics from the marine sources. So we can say these types of antibiotics we can say here these are that types of antibiotics which we are obtained from the fermentation of the microorganism. Example, we have in natural antibiotics we have a bactericin and we have a polymyxin B. And second one, we have a semi-synthetic antibiotics. What are semi-synthetic antibiotics? So semi-synthetic antibiotics, we can say we have a 50% of natural source and 50% we are using the chemical. After that we will get a final product. That product we can say that is the semi-synthetic antibiotic, because 50% of natural compound and 50% of chemicals we are used. After that we will get a new compound, that is the semi-synthetic antibiotics. Here we can say they are produced commercially by addition the chemical agents to produce the final product. So here we have an example, that is the penicillin V. So penicillin V is made up of the 50% of natural product and 50% of the chemical. And also we have another example, that is the penicillin G. So penicillin V and penicillin G is the semi-synthetic antibiotic. And here we have a third one, that is the synthetic antibiotic. So synthetic antibiotic, we can say antibiotic which have purely synthetic origin. Here we have an example, that is the chlorophenicol. It is basically made up of by chemicals. So third one, that is the based on the mechanism of action. So first of all, we have to know whenever we are taking the antibiotics, at that time they can show two types of mechanism. One is the bactericidal and one is the bacteriostatic. If we are talking about the statics, so at that time that type of antibiotics can be inhibit the growth of bacteria. Now if we are talking about the cidal, so that time that antibiotics can kill the bacteria. For example, if someone is having a fever, so at that time he or she will be taking the medication. So first of all, that medication will be interfere with the biosynthesis of bacteria cell wall. Example, we have a cephalosporin, we have a penicillin, we have a vancomycin. And second, when we are taking the medication, after that bacteria cell wall can be destroyed. When bacteria cell wall will be destroyed, after that the function of the cytoplasmic membrane will be disturbed. So here we have some examples. We have a neostatin, we have a amphotericin, and we have a polymyxin. And after that bacteria, whenever we are taking the antibiotics, they can be inhibit the synthesis of bacteria cell wall. When we have to inhibit the cell wall, or we can say we have to destroy the nucleic acid, because all of we know bacteria, whether it's a gram positive, whether it's a gram negative, it will be grow rapidly. So we have to take the antibiotics that antibiotics can kill the bacteria, then we will free from that diseases. So fourth one, that is the based on the chemical structures. So on the basis of chemical structures, we can classify the antibiotics in 8 classes. One is the beta-lactam antibiotics. So second one, that is the aminoglycosides, and the third one, that is the tetracyclines, and the fourth one, that is the peptide antibiotics, and the fifth one, that is the macrolides, and the sixth one, that is the lycomycin, and the seventh one, that is the antifungal antibiotics, and the eighth one, that is the miscellaneous compound. So here we have a first class, that is the beta-lactam antibiotics. So what are the beta-lactam antibiotics? So we can define the beta-lactam antibiotics. These are that types of drugs which contain the beta-lactam ring in the structure. For example, we have a penicillin. So penicillin contains the beta-lactam ring, so that's why we can say that penicillin is belonging to the class of beta-lactam antibiotics. We have a second example, that is the cephalosporin. Next we have a monobactamase, and we have a beta-lactamase inhibitors. So these types of drugs contains the beta-lactam ring, so that's why we can say that are the beta-lactam antibiotics. Next we have a aminoglycoside antibiotics. So these are those types of drugs that contains the sugar moiety with the amino group. We have a structure, that structure contains the NH2 group, and also we have a O group, and that types of drugs can have the glycosidic bond. We have some drugs that contains the sugar moiety and the amino group. We have some examples, that is the streptomycin, gentamicin, neomycin, and the kanamycin. And third one, that are the tetracyclines. So aminoglycosides have the we can say aminoglycosides are the broad spectrum antibiotics. Why broad spectrum antibiotics? Because it can be kill gram positive, it can be kill the gram negative bacteria, gram positive bacteria, as well as if he or she has another infection, that time it can be treat. So we can say aminoglycosides are the broad spectrum antibiotics. So here we have a third one, that is the tetracyclines, drugs that contains the 4 cyclic compounds. So here we have some examples, that is the chlorotetracyclines and oxotetracyclines. So tetracyclines is also the broad spectrum antibiotics. So fourth one, that is the peptide antibiotics. Peptide antibiotics we can define, these are those types of drugs that contain the amino acid group. Example, we have a bacitracin and amphotericin. And the fifth one, that are the macrolides. So macrolides we can say they contain the microcyclic ring with the lactose group. Example, we have a erythromycin and we have a azithromycin. Sixth one, we have a class that is the lycomycin. Lycomycin are the drugs that contain the more than 16 atoms. Example, we have a lycomycin and we have a clindamycin. And seventh one, that is the antifungal antibiotics. So what are the antifungal antibiotics? Antifungal, we can say these are those types of drugs which can be treat the antifungal infections. Example, we have a gerasoflavin. And the eighth one, we have a miscellaneous compound. So in miscellaneous compound, we have an example that is the chlorophenicol. So here we have a first compound, that is the penicillin. So that penicillin is belonging to the class of beta-lactam antibiotics. So all of we know penicillin is the secondary metabolite produced by various bacteria. In first slide, I told you we are synthesizing a penicillin from the bacteria. That bacteria is fungi. So this penicillin can be this penicillin can be kill so many types of microbes. So here we can say penicillin is a beta-lactam antibiotic. So a bacteria infection is caused by millions of tiny bacteria that are trying to survive by multiple in the host. Antibiotics attacks and kill this bacteria. So here we have a penicillin. So penicillin is used as an antibiotic. It is obtained from the Penicillium notatum. Here you can see the diagram, that is the Penicillium notatum where we are collecting. But nowadays we are collecting that penicillin from the Penicillium cruceginum. So before the development of the penicillin, in ancient times we have no medication. We have no medication for the treatment of the bacterial infection. But nowadays we have lots of antibiotics to treat the so many types of bacterial infections. So many people was died and suffered from the bacterial infections, because in ancient times in ancient period of times, at that time we have no medication to treat the bacterial infections. So here we have a next point. So Alexander Fleming gave us the penicillin in 1928. Penicillin G is the first antibiotic penicillin introduced into the chemotherapy. So next we have a nomenclature. Nomenclature of penicillin. We have to give the scientific name. We have synthesized a compound, that is the penicillin. So we have to give the scientific name of this compound. So we can say penicillin is a beta-lactam antibiotic. Why we can say penicillin is a beta-lactam antibiotic? Because it contains the beta-lactam ring. Here you can see that I had given you the diagram. In this diagram you can see the basic structure of the penicillin. So in this penicillin you can see there is the thiazolidine ring, and here you have a beta-lactam ring, and also here you have a carboxylic group, you have a amide group, and you have a thioether group. So we have to give the numbering where we have to start the first position. You can see the thiazolidine ring contains the S group. From the S group we can start the 1, and here you have a 1, and here where we have attached the 2 methyl groups, you can consider it as 2, and in carboxylic group, that is the 3rd position, N group, that is the 4th position, and here you have a 5th position, and here you have a 6th position. With the 6th position, here in 6th position we have a amino group. So we have to write down 6 acyl amino, and in 2 position we have a 2 methyl groups attached. So we can write down 2, 2 dimethyl, and in 3rd position we have a carboxylic group. So we can say the name of the compound of penicillin, we can say that is the 6 acyl amino 2, 2 dimethyl 3 carboxylic acid. So this is the scientific name of the penicillin. So we have to give the numbering from the thiazolidine ring. Thiazolidine ring contains the S. So from S we have to give the number 1. So next we have a stereochemistry. What is the stereochemistry of the penicillin? So here we have a penicillin. Penicillin structure contains the 3 chiral carbons at the C3, C5 and C6. So first thing you have to know what is the chiral carbon. So chiral carbon, we can say we have a S compound. For example, this is the S compound, and in upper position we have a O group, in lower position we have a F group, and in right side we have a H group, and here we have some another compound, it will be the S, whatever it will be. So that carbon compound which contains the different types of the functional groups, so we can say at that time that is the chiral carbon. So next thing we have a achiral. What is achiral? So for example, here we have a C group, here we have a compound that is the C. That C contains the same functional group. For example, in upper side we have a O and in lower side we have a O. So there we have a same two functional groups. So at that time we can say that are the achiral carbons. Why? Because they contains the same functional groups. So in penicillin contains the 3 chiral carbons in C3, C5 and C6. Here you can see the structure. In C3 position we have a C, and here they contains 2 methyl groups. Here it contains the carboxyl group, here it contains the N, and with the C we have a H. So here you can say that is the chiral carbon. Why? Because it contains the 4 different functional groups. So in penicillin we can say there are the 3 chiral carbons present in the penicillin structure, in C3, in C5 and in C6. So C6 is showing the L configuration, and C3 and C6 we can say that are the chiral centers. Why they are the chiral centers? Because they are trans to each other. We can say they are facing opposite to each other. So that's why we can say that are the chiral centers. So in stereochemistry of penicillin we can say there are the 3 chiral carbons present, one in C3, one in C5 and one in C6, and C3 and C6 are the chiral centers. Why? Because they are trans to each other. So all the synthetic and the semi-synthetic penicillin have same absolute configuration, that of nature. So next we have a SAR of penicillin. What is the SAR of penicillin? So we can define, we can say SAR, that is the structure activity relationship of penicillin. For example, here you can see here we have a structure of penicillin. At the position 1 we had attached the S. If we are removing the S, we are attaching the sulfone or we are attaching the sulfur oxide. At that time the activity of the compound will be the decrease. So in second position we have methyl group. So methyl group are necessary for the activity. So if we are replacing the methyl group in the position 2, so at that time the activity of the compound will be decreases. So in third position we have a carboxylic group. So carboxylic, whenever we have to show the antibacterial, activity. For the antibacterial activity we have to need the thiazolidine ring. So in third position we have a thiazolidine ring, and that thiazolidine ring contains the carboxylic group. So it is essential for the antibacterial activity. Replacement of the carboxylic group with ether or alcohol, at that time same way the compound will be decreases the activity. So we cannot remove the carboxylic group with ether or alcohol. If we are adding ether or alcohol, so at that time the activity will be the decreases. So beta lactam ring, I told you, if we are talking about the beta lactam antibiotics, so it is very essential to contain the beta lactam ring. For the antibiotics, beta lactam ring is very essential. So beta lactam ring contains the N, so N is necessary. And if we have to attach the new compound, if we have to attach the new thing, so at that time we cannot go for the 5th position. We have to attach, go for the 6th position or the 7th position. So we cannot attach anything in the 5th position. If we are attaching, if we are substitute the new thing in the 5th position, at that time the compound, the activity of the compound will be the decrease. So amide chain with R group, ether alkyl or arar group is essential for the antibacterial activity, and also we can say beta lactam ring is required for the beta lactam antibiotics. Next, here we have a penicillin. So this penicillin, we can say the name or the scientific name of this penicillin, that is the benzyl penicillin. This structure was the simple structure of the penicillin. Here we have a benzyl penicillin. So this benzyl penicillin, this is the semi-synthetic. This penicillin G is the semi-synthetic antibiotic. Here you can say in this structure we have a thiazolidine ring, we have a beta lactam ring, we have a carboxylic group, and here we are attaching the one new compound compound, that is the benzene ring. So this benzyl penicillin, we can say we can use this benzyl penicillin for the various treatment. Use it as a treatment of various bacterial infections caused by the staphylococci and gram-positive bacilli. So here we can say this benzyl penicillin have the narrow spectrum antibiotics. Why narrow spectrum? Because it will kill only the one type of bacteria, whether it's a gram positive, whether it's a gram negative. So whenever we are taking the narrow antibiotics, they can kill only the one type of bacteria, whether it's a gram positive, whether it's a gram negative. Next we have a phenoxymethyl penicillin, and also we can say that is the penicillin V. Same, this penicillin V is a semi-synthetic antibiotic. So here you can see this penicillin contains the thiazolidine ring, amide ring, this penicillin contains the thiazolidine ring, beta-lactam ring, carboxylic acid, amide group, and here you can say this, here we are attaching the benzene ring with O. So here this penicillin V is effective for the treatment of soft tissue and the skin infection caused by the suspectable bacteria, and also we can say it can be treated for the rheumatic fever, and also it will be effective for if someone is having the cavity infection. So at that time he or she can be take the penicillin V. Next we have another drug that is a very important drug, that is the amoxicillin. So amoxicillin, you can see the structure, that amoxicillin contains the thiazolidine ring, beta-lactam ring, carboxylic group and amide group, and here it contains the benzene ring with the OH. So this amoxicillin, we can say that the mechanism of action is the bactericidal or the bacteriostatics, or we can say that that amoxicillin have the broad spectrum antibiotics. Why broad spectrum? Because it kills the gram positive as well as it kills the gram negative. So the uses of the amoxicillin, we can say it can be treat the upper respiratory tract infection, it can be treat the urinary tract infection, and also amoxicillin is effective to treat bacterial infections of ear, nose, throat, etc., etc. So here we have a next, that is the side effect and toxicity of the antibiotics. If someone is having a fever, at that time doctor give the drugs and say yeah, these types of drugs you can take for the 3 days. If we are taking regularly antibiotics, at that time it will be the very dangerous for us. For example, if we are taking lots of antibiotics, at that time maybe we will be affected by the disc generation, disc degenerative, allergy, hypersensitivity reaction, bleeding, degenerative changes in the spinal cord. We cannot take the antibiotics in large amount. If you have a course for the 3 days, you can take that antibiotics only for the 3 days. So after that, if you are taking regularly antibiotics, it will be the very dangerous for us. So this is all for in this lecture. So if you have any query, any question, then you can tell me. Thank you so much.